Liver damage often goes unnoticed, especially in the early stages. The liver is a vital organ that plays a huge role in digestion, detoxification, and energy production, but it doesn't always show clear symptoms when it starts to fail. It's important to remember that liver damage isn't caused only by alcohol. Processed foods, sugary diets, painkillers like acetaminophen, and even infections such as hepatitis can contribute to liver issues. The good news is, if you catch the signs early, many cases of liver damage can be reversed with lifestyle changes and awareness. In today's video, we'll uncover 12 strange signs of liver damage that you should never ignore. Causes of liver damage. Before diving into the signs, let's talk briefly about the common causes of liver damage. Alcohol abuse is a major culprit, but that's not the only cause. Chronic use of painkillers, especially acetaminophen and ibuprofen, can put excessive strain on the liver. A sugar-heavy diet, fast food, and vegetable oils also stress the liver, potentially leading to fatty liver disease and liver inflammation. Infections, such as hepatitis, can also lead to liver damage. The liver is incredibly resilient, but these habits, if continued over time, can cause significant harm. Recognizing the early warning signs is crucial to protecting your liver and overall health. 12. Weird signs of liver damage. Let's now discuss the 12 strange signs of liver damage that you must watch out for. Light-colored or floating stools. One of the earliest signs of liver damage is light-colored or floating stools. This happens when the liver isn't producing enough bile, which is needed to break down fats. Without enough bile, your stools may become pale or even float. This could indicate fatty liver or a bile duct blockage. If you notice this, it's time to consult your doctor. Night vision problems, difficulty seeing in dim light, or night blindness could also signal liver damage. When your liver isn't functioning well, it can lead to a deficiency in vitamin A, which is essential for healthy vision. As a result, you may experience blurry vision, dry eyes, or even gritty, irritated eyes, especially when you're in low light conditions. Swollen right foot swelling in the right foot, or sometimes in both feet, could be a sign that your liver is in distress. Liver damage can increase pressure in the portal vein, leading to fluid retention. The swelling in your right foot is especially concerning because it's often linked to liver dysfunction. If you notice this, seek medical attention to understand the root cause. White eyelid growths. White growths around your eyelids, often referred to as cholesterol deposits, could be a sign of liver trouble. This happens when your liver is unable to process cholesterol properly. These deposits may appear around the eyes, typically near the eyelids or corners. If you see these growths, it's time for a liver checkup. Pressure on right side, under ribs. Feeling pressure or discomfort in the upper right side of your abdomen, just under the ribs, could indicate liver issues. The liver is located in this area, and if it's under stress, you may feel a sensation of pressure or fullness. This discomfort could radiate to the right shoulder and may be accompanied by other symptoms, like bloating or indigestion. If persistent, get it checked. Purple or red skin spots. Have you noticed purple or red spots on your skin? These spots are a result of bruising or rashes and are caused by low clotting factors due to liver dysfunction. A healthy liver produces proteins essential for blood clotting, but when it's damaged, clotting factors drop, leading to bruises or skin spots. If these spots appear without any reason, it's worth talking to your doctor. Cracked heels. Cracked or dry heels could be another indication that your liver is under stress. When the liver struggles to perform its job, it can lead to a vitamin B3, niacin deficiency. This vitamin is important for maintaining healthy skin and hydration. Without it, your skin may become cracked and dry, particularly on the heels. Persistent itching, especially on the hands and feet, is another unusual sign of liver damage. This occurs when bile acids accumulate under the skin due to poor liver function. The accumulation of these acids can cause a persistent and intense itching sensation that may get worse at night. If you experience this, don't ignore it. It could be related to liver problems. 9. White or clubbed nails. If your nails are turning white or becoming rounded and clubbed, it could indicate a lack of oxygen supply to the nail beds, a condition strongly linked to liver disease. As the liver fails to filter toxins from the blood, these changes in the nails can occur. If you notice these signs, it's important to seek medical attention immediately. Dark urine can be a sign that your liver is struggling. When the liver isn't functioning properly, excess bilirubin builds up and is excreted through the urine, causing it to turn dark. This could also be worsened by medications that stress the liver, so if you notice this change, be sure to consult your healthcare provider. Yellowed skin, jaundice. Jaundice, or yellowing of the skin and eyes, is one of the most noticeable and alarming signs of liver damage. When the liver can no longer process bilirubin, a yellowish pigment, it builds up in the body, giving the skin and eyes a yellowish tint. Jaundice is a serious sign of advanced liver damage or hepatitis and requires immediate medical attention. Spider veins. Spider veins are tiny red lines or dots that may appear on your skin. These veins are often caused by a buildup of estrogen in the body due to liver dysfunction. If the liver isn't filtering properly, estrogen levels can rise, leading to these visible veins commonly found on the face, chest, and limbs. If you notice these veins, it's important to consult with a doctor. How to reverse liver damage. Liver damage occurs in stages, and it's crucial to know where you are in the process. Fatty liver inflammation, fibrosis, scarring. Cirrhosis, severe, irreversible damage. However, don't lose hope. Your liver has an incredible ability to heal itself, but it needs your support. Here are a few strategies to reverse liver damage. Fix your diet, eliminate sugar, processed foods, and too much fruit. These foods can stress the liver and lead to fatty liver disease. Eat liver-friendly foods. Leafy greens, garlic, mushrooms, and foods rich in sulfur can help reduce liver fat and detoxify your body. Avoid excessive alcohol and refined carbs. These can worsen liver damage and contribute to fatty liver disease. Hydration and natural support. Stay hydrated. Drink at least 1 liter of clean water daily. Try turmeric and coffee. Both of these support liver health and reduce inflammation. Add lemon or lime to your water. These enhance bile production, which helps in fat breakdown and liver detoxification. The liver can heal itself, but only if you give it the support it needs. Pay attention to any unusual symptoms and don't ignore the early warning signs of liver damage. Small lifestyle changes like improving your diet and staying hydrated can make a big difference in liver health. Take charge of your health. Now your liver will thank you later.